India is in the group of COVID's third wave. A lot of inaccurate information related to the virus and its treatment is doing the rounds, especially on the internet. To address this important issue, I'm joined by a very special guest and one of the most credible voices on COVID in the country, Dr. Gagandeep Kang. She is, as I said, India's top virologist, but also the most credible voice in the country when it comes to COVID. We are doing this conversation because Dr. Kang says that monoclonal antibody products and the therapy in India do not neutralize the virus, especially the Omicron variant. Dr. Kang, thank you so much for making time and speaking to Mirror Now. You have called the COVID antibody therapy unethical, unscientific. You've underlined that. For the benefit of our viewers, could you help us understand why and a bit about the therapy itself and your views against it?
Sure. So, as we all know, SARS-CoV-2 is an infection with a virus. And one of the ways that we can prevent the virus from getting inside cells is by naturally making antibodies against it or artificially giving antibodies against the virus. What we expect these antibodies to do is to block the entry of the virus into host cells. When we give vaccines, that's what we are trying to do. We are getting the body to naturally make antibodies. This happens also when we get infected, that we make antibodies that are able to neutralize the virus. Now, if you're infected with one virus, that doesn't mean that you will make antibodies that will neutralize all variants of the virus. And similarly, when we use antibodies for treatment, it's possible that antibodies that were developed against one virus will not neutralize other viruses. For Omicron, it's very clear that the antibodies that are currently available in India do not neutralize the Omicron variant. They were reasonable against Delta, but they don't neutralize the Omicron variant. And in fact, there is only one set of antibodies that is widely commercially available, which is the GSK monoclonal antibody, not available in India. It's called sotrovimab, and that's the one that can neutralize Omicron variant very well. AstraZeneca also has a monoclonal antibody called Evusheld that is somewhat reasonable against Omicron, but that also is not available in India. So monoclonal cocktails available in India do not neutralize the Omicron variant. And we need to know this so that there isn't irrational therapy.
Absolutely. Dr. Kang, you've also sent out a very strong message through your tweets to both the doctors and patients, and I'll come to each in a bit. To doctors, you say practice good medicine, and to patients, you ask them to be vigilant and ask questions on the drugs that are being prescribed to them. This is a very important piece of advisory. Could you please elaborate on that, please?
Well, you know, we've seen what happens when you have irrational therapies. Everybody will remember the second wave and how in the second wave, what was practiced was essentially polypharmacy. Lots of people who got infected, who tested positive, who had mild symptoms or moderate symptoms, were given 15 to 20 drugs to take. And many of those were things that were inappropriate to use. For example, antibiotics or steroids, which were not called for at all. And that resulted in India having the maximum amount of mucormycosis, black fungus infections. If we had not had irrational treatment at that time, we would not have had people have this secondary suffering in addition to the diagnosis of SARS-CoV-2. That's why I think for both doctors and for patients, there is an importance to understanding what the state of science is today and then following along with that. Most people do not need any treatment at all. Most people who are reasonably healthy, who test positive, will require nothing, or at the most paracetamol and maybe cetirizine, and that's pretty much it. It's if you have comorbidities, if you wind up in hospital, that you will more likely require other treatments as well. And there you should be able to rely on doctors to advise you on what to take. The guidance that has been put out by the government of India, the ICMR AIMS guidance, is very sensible, and that is what we should be following for different levels of severity. And for patients, my advice is if a doctor gives you 10 or 15 medications, if all you have is a fever and some respiratory symptoms, do please question your doctor about what they are giving you and why.
Right, that's a very, very important piece of advice, Dr. Kang. USFDA has limited this monoclonal therapy use. India's revised guidelines also don't mention it. Then why do you think it's being prescribed in India? Why do you think doctors are going for it?
Well, one of the reasons is what people call just-in-case treatment. So right now, we are reasonably sure that about 90% of everything that you see in major cities in the country, maybe more than that, is Omicron. But there is a very, very, very small chance that it might be Delta. And if it is Delta, then maybe the monoclonal antibody will work. So if you have a patient who can generally afford to have relatively expensive treatment, then you can make the argument that there is a small chance that it might benefit this particular person. So I'm not denying that that might be the case, but I'm reasonably sure that in most cases, people who are given these treatments do not need any monoclonal antibody therapy. And if we are to give monoclonal antibody therapy, we should be giving it only to people where we are certain that the infection that they have is a Delta variant or some other variant that is not Omicron.
Okay. Dr. Kang, let's now talk about, in detail about the third wave. We now know that the pandemic is in community transmission mode. What is your assessment of the current situation and the trajectory?
Well, I think we seem to be following a path that is very much like that of South Africa, where there was a lot of natural infection and a reasonable, less than India, vaccine coverage. And they managed to weather their Omicron wave quite easily. They had about 4 weeks of cases going up and about 4 weeks of cases going down. And that seems to be the pattern that we are also following, where we've had cases going up for about a month and starting to come down in places where the infection hit early. There's no reason to think that it's going to behave differently in India. And we are in some ways very fortunate that we've had such a large proportion of our population vaccinated with 2 doses and a reasonable degree of prior infection as well.
Okay. Ma'am, what is your view on the COVID restrictions that are in place? Schools have opened in Maharashtra, but in some places there are weekend curfews and night curfews. What is your view on that?
Well, weekend curfews and night curfews do not make a difference. I think the opening of schools is very important. I am so glad that it is beginning to be done in many places. The best protection that we have, in addition to people being vaccinated and or infected, is to wear masks. And the better the quality of the mask, the greater the degree of protection. Stopping people going out at night, stopping people going out on weekends doesn't really make as much of a difference as masks do.
Okay. Dr. Kang, there was a report in the past that 5 genome sequencing labs have shut down due to lack of funds. The labs ran out essentially of funds to buy the compounds that are required to sequence positive patients. Do you think it is a big setback to India's COVID efforts?
I think it's important to understand that we had not reached the capacity of sequencing that is available in India. Remember that all the labs in the NSACOG network are government laboratories, and there is sequencing capacity in the private sector that is also capable of doing sequencing. So the fact that some government labs have closed just means that there need to be resources that are directed at these government labs to give them the support that they need. But I think in addition to supporting government labs, we also should be thinking about how long we want to maintain restrictions on and decide who should be sequencing the virus. It's everywhere. And if allowing private sector sequencing gives you more rapid results, and especially results that can inform treatment, it just makes sense to open it up and let people sequence more.
Okay. Dr. Kang, WHO has said, and everybody has sort of, somebody have taken it in a light vein, somebody have basically been affected by it, that Omicron will not be the last variant. It seems like an endless loop. How do you keep yourself sane and positive, and what would you tell our viewers if they are feeling burnt out due to this life in pandemic? This too shall pass?
Absolutely. This won't pass. We'll live with it. We've learned to live with a lot of different things. You might remember the excitement that we had in 2009 when we had the swine flu virus. Swine flu has gone on to be one of the circulating viruses that we deal with every year, and we don't fuss as much about it. Now, obviously, Omicron and the other variants, because of their transmissibility, because this was a virus we had not encountered as a race before, it has been very different. But I have incredible faith in science, and I have incredible faith in human resilience. Science has given us vaccines, science has given us drugs, science has given us sequencing tools, all of which we can use to make sure that the consequences of this infection can be mitigated. And when it comes to human resilience, I think the one thing that we need to understand is that all of us as communities, as families, as groups at work, at home, are stronger together. So the more we support each other, we are there for each other physically, emotionally, I think the more of a difference we'll make to all of our futures.
All right. I will also take a cue from that answer. One last question, ma'am. This is a very important year, election year. Luckily, Election Commission did, spell out certain boundaries for political parties, but we also see some violations as well. For our politicians, for our people as well, people who are stepping out, what is your message to them? And as you said that we have learned to live with the pandemic and this won't pass, for now at least. So what is your message to our viewers?
I think the most important thing is to identify and protect the most vulnerable, because we know that if they get infected, they are the ones that are likely to suffer the most. So to make sure that their vaccinations are up to date, that if they have symptoms, they get tested early and taken for treatment early. And as far as possible, we try and limit infections for them. That is really the critical thing that we need to be doing to protect the most vulnerable in our society. Beyond that, the rest of us who are generally healthy, it's not like we are 100% safe, but in all of our activities, we must balance risk with the benefits of the activities that we undertake. As long as we are comfortable with the choices of risk, then we should just go ahead with the activities that we would like to be able to do.
All right. Thank you so much, Dr. Kang. As always, it's a pleasure to have you on Mirror Now. And as always, thank you for your patience, for answering all our questions. Thank you for your time.